We've waited long enough. Now more than ever, we need safe access to dispose of these drugs.
In 2018, New York State passed a Drug Take Back Act, a law requiring pharmaceutical manufacturers to provide safe and convenient drug disposals for the public.
We have a lot of leftover prescription drugs that are a major threat to public health and our environment.
Smith says up to 30% of drugs prescribed are disposed of.
We're talking about 30%. We're talking about millions of pounds of excess drugs.
And those drugs, he says, are ending up in our water supply.
What's happening is that when people have leftover drugs, they're sometimes flushing them. These suits are not designed to remove these contaminants, meaning that these contaminants end up in our water supplies, the Great Lakes and other water sources.
Or they end up in the hands of our loved ones.
People are leaving them in their medicine cabinets, and what that helps contribute to is drug overdoses and accidental poisonings.
So the Drug Take Back Act was enacted to give residents a safe option to dispose their drugs. But Smith says it hasn't been followed through.
Here we are, as I said, over 2 years later, we're experiencing a pandemic, and there's evidence of an uptick in the problems with the opioid epidemic.
Smith and his coalition are asking the New York State Department of Health to reinforce this 2-year-old law.
They need a place to go, and they need a safe place to go.
In Buffalo, Jenny Johnson, 7 Eyewitness News.